Hello, my name is Lynda Ross and I'm an accredited practicing dietitian and senior lecturer at QUT. Today I'd like to talk to you about palliative care and the end-of-life pathway. Palliative care is a person and family-centred model of care, meaning that the patient, family and carers can receive practical and emotional support. This is provided to a person with an active, progressive, advanced disease who has little or no prospect of cure and is expected to die. The primary goal in this case is to optimise the quality of life and affirm life and regard dying as a normal process. It intends neither to hasten or postpone death, but to help people live their life as fully and as comfortably as possible when living with a terminal illness. Allative Care identifies and treats symptoms which may be physical, emotional, spiritual or social. It is based on the needs of the individual, but the services offered may include relief of pain and other symptoms, resources, equipment needed to keep someone in their own home, assistance for families to come together and talk about the issues surrounding the patient, can link people to other services such as home health and financial support, and support people to meet their cultural needs, their emotional, social and spiritual concerns, provide counselling and grief support and referral to respite care services. Palliative care is applicable early in the course of illness. A lot of people don't realise this. A person does not have to be bedridden or dying in a few weeks to enter the palliative care pathway. As soon as a terminal illness is diagnosed, palliative care services can begin, and the person could be still quite active and not in hospital at this stage. It's done in conjunction with other therapies to prolong life, such as non-curative chemo or radiation therapy, investigations to manage their clinical symptoms or complications, and it uses a team-based approach to address the needs of patients and their families, including counselling. So who provides this team-based approach? Well, there's specialist providers that include the multidisciplinary team, so medical, nursing and allied health. These people have usually undertaken further study in palliative care or have some significant experience in being involved in palliative care services. There's other support services, including those who assist with the daily living and enhancing the quality of life from day to day, such as aged care workers, or providing emotional and spiritual support, such as a religious minister. The end-of-life pathway does take into account the terminal phase, or when the patient is recognised as imminently dying. End-of-life care, therefore, is in the last few weeks of life. This is when a patient with a life-limiting illness is rapidly approaching death. This is a time when the needs of the patient and the carers and family is at its highest, and recognises that there's an increased need for services and support at this time, and very important that all care is well coordinated by the healthcare team, that there's communication and coordinated delivery. So the end-of-life pathway in this way should provide a systematic approach. It's a standardised level of care. The framework includes documentation of all discussions with the patient, carers, the multidisciplinary team. This is regarded as best practice for guiding the care of these patients, highly regarded as part of the palliative care process, widely implemented both nationally and internationally. And the Liverpool Care Pathway in the UK is the most recognised and commonly used pathway, particularly to transfer the hospice model of care for the dying to other care settings.